1 in 100 children has a heart defect. And some of those children have a very complicated heart defect called hypoplastic left heart syndrome. Those children have a pumping chamber which has to pump the blood both out to the lungs as well as out to the body, and actually have to have a surgery in the first week to 10 days of life that connects those two blood vessels together and then puts a little tube into the lungs called a shunt, or the Norwood procedure. About a year ago, we decided to try to see whether or not we could use telemedicine or technology in the home to provide some additional access and information on how children are doing and allow parents to communicate with us. The basic idea is we're using very simple telemedicine technology, which is essentially a modem which plugs into the telephone line, the standard scale that infants use when they're being weighed, and a pulse oximeter that can go onto the finger to measure the oxygen saturation. We take this technology with this telephone modem. We can provide that into the homes of families where their children have gone home after having had heart surgery. That's what's in the home with the family. And then what's behind the technology is a website that allows us to essentially on a daily basis have parents measure the baby's weight, measure the baby's oxygen saturation, and answer a series of very simple questions on how the baby's doing. So the purpose of our program is to be able to evaluate technologies and see whether or not something as simple as a telephone modem coupled to weight or saturation can get parents to send us information on a much more frequent basis, on a daily basis, versus having to go to the local emergency room or to the local physician's office.